one thing that we do care about and we're very deliberate about. It is something that we want for us all to benefit from. It is the health and well-being of every Lagosian and every Nigerian in Lagos. It is something that is not limited to tribe, cultural beliefs, religion, or whatsoever. Ilera Eco. As far as you're a resident in Lagos and you live in Lagos, you can benefit from the Ilera Eco conversation. And today on the show, of course, I told you that I will not be doing this alone. This is the premiere edition of Ilera Eco on Family Matters, of course, bringing you some updates on the things that concern your health. And we have a guest in the studio. She's been here before, having this conversation with us and telling the public what to expect, what you need to know, bringing you up to speed with healthcare in Lagos State. So if you're listening right now, please make welcome the Lagos State Health Management Agency Permanent Secretary, Dr Emmanuella Zamba. It's good to have you on the show today, ma'am.
Thank you, and good morning.
Good morning, ma. You look really very amazing, ma. Thank you so much for making out time to be here with us today.
Thank you.
Okay, so we're here to talk about Ilera Eco, which is something that is dear to the heart of the governor of Lagos State. It's something that you have been all about. Recently, we some point last year we had the Jara Plus upgrade, and we had some conversations. The governor was there briefing newsmen and people from all walks of life. Because we saw that people from the market in Ikorodu, the Yalojas, and everybody were present at that event, just to bring it to the forefront and bring it into the consciousness of the people that there is something called Ilera Eco. Now, understanding healthcare, because our focus is mandatory health insurance and the law in Lagos and Nigeria. So let's even start with you telling us what health insurance is as far as the Lagos State government is concerned.
Thank you for the question. In Lagos State, health insurance is now mandatory.
Mm-hmm.
We have a habit in Lagos, once you're not within the corporate Lagos where your company would have you sign on to health insurance, and most people just take their health sort of for granted. And eventually when they do fall sick, they have to pay out of pocket, which eventually sometimes leads some families into impoverishment. So in order for us to ensure that people have adequate, affordable healthcare that is qualitative, without breaking the bank, and ensuring that we're able to continuously live a good quality standard of life.
Of life, yes.
The Lagos State government has made health insurance compulsory in Lagos State. In particular, it has said that you have to join the social health insurance scheme, which is like the basic health plan for Lagos State.
Okay.
And is making all the modalities possible for you to be able to sign up and join the scheme. It is a partnership also with the private health insurance. So within the private health insurance sector, there is methodology for you to be able to ensure that you are covered under the semblance of Ilera Eco, the Ilera Eco plan.
Okay.
Yeah.
And this is amazing. And you said some things that are very, very important, because if we're making laws that says you must be a part of something, there must have been a reason for us to make that. We've created a standard that says that you can afford this through something that the government itself is doing. And that's why this is very, very laudable, and we appreciate that. So talking about the Lagos State Health Insurance Plan, how does this work? How do we get into it? What do I have to do?
Okay. So all you have to do really is be alive and live in Lagos State. You are automatically eligible to come onto the scheme. Of course, you have to be an adult above 23 to be able to come on and sign on.
Okay. As an individual.
Otherwise, you would have to be under someone else's plan as a dependent, maybe your parent or your guardian or whatever. Initially, it used to be 18 years, but because we realized children are still in school up to 21, 22, 23, we extended the dependence age. So if you're under 23, you can be under the plan of your parents.
Okay.
You can join us in various ways. You can go onto our website, www.lashma.com, or you can join through phone calls. We have a 24-hour call center. And the lines are actually toll free, so you can call 0800 Ilera Eco or 0800 Ask LASHMA. Anybody will answer you at any time of the day, and you can come on board.
Any time of the day?
Any time of
That's
the day.
amazing
It's
to hear.
24 hours. And then we also have a USSD, which you can do on your phone very simply, and that is attractive for the informal sector who don't have smartphones and can't go on websites.
Okay.
So with *6700 *006 hash.
Okay.
You can join Ilera. It will walk you through the modalities. If you're not, you can also send us an email on ileraiko@lashma.com. You can call us on our WhatsApp numbers, which we'll give
in the course of the show.
in the course of the show. We have 2 WhatsApp lines that you can reach us on as well. You can walk into our divisional offices or our kiosks that are spread across Lagos. We are in all the divisions of Lagos State.
Yeah.
And we can also provide information as to where those sites are domiciled. We're also partnering with LASRA.
Yeah.
So in a LASRA office, you can walk in there and you'll get information as to how you can come on board on Lagos State. And we're going to expand the network as we go along.
Of course, expanding the network is one of the reasons why you've been
Indeed.
in this partnership with Super FM, bringing this information to the public in Lagos. Now, this thing is not something that is statutory. It is the law. It is the law in Lagos that you must have an health insurance plan for yourself as an individual or your family, because we understand how expensive healthcare can be. And if the government is making this, now that you just explained health insurance plans, the popularity, this health insurance plan that is popularly known as Ilera, and it is now mandatory that you are part of it. In Lagos State, can you explain the significance of this particular policy? Because someone is probably listening right now and said, should they go catch me? Or maybe they go arrest me for road or something.
Okay. So let's look at it from the point of view of the fact that at some point in anybody's life, something is going to come visiting you in the form of illness. If it is not you directly, it will be a member of your family.
Yeah.
Number one, it will not tell you when it will come. Number two, it will not tell you how it will come and how severe it will come. Number three, it's not going to tell you how much of your pocket it's going to drain. Therefore, because we've seen a lot of people that suddenly their wife was pregnant for 9 months, for instance, and then suddenly she needs a cesarean section, and they start running all over the place trying to look for funds.
Yeah.
Even though government is doing its own bit in trying to subsidize healthcare and
Such
whatever,
payments,
the money must come from somewhere. And this scheme, as it is heavily subsidized. So all you need to do is contribute your own quota into it. And whatever healthcare needs you have, you'll be able to walk into your chosen facility and get this. Whether there's 0 naira reading in your pocket on that day, you're guaranteed the healthcare. So, I mean, it's a no-brainer. If you want to be a contributory, productive member of society, if you want to ensure that the life of your family is stable, standardized, and of good quality, depending on your earning power, and that sudden illness is not going to give you financial impoverishment. This is something that's really necessary for every forward country, whether it's globally. Universal health coverage. You must have health insurance.
Yes, you must.
You must have health insurance.
Which is a beautiful way to put it. You must have health insurance. You talked about anything could come.
Yeah.
Old age. At the symposium that was organized last year, talking about the Jara Plus plans, because I was there and I listened, and I already understood that there was a seniors plan on this entire thing, and then age is something that makes people need healthcare essentially, because you can't do what you used to be able to do. So these are all of the things that come into consideration. Now, if you want to be a part of this conversation, you're listening right now, you can call the number 0805 092 0927. You could also call 0705 890 4927. Alternatively, you could send a WhatsApp message to 0705 69 Of course, you want to ask a question from the Dr. Emmanuella Zamba, who is the Permanent Secretary of the Lagos State Health Management Agency. She's right here in the studio with us, giving us some updates. Did you know initially that this was something that was made statutory by law in Lagos State, that you must have healthcare? Don't be caught in ignorance. You need to ask questions. You can call these numbers that I've listed right now. You could also, if you're watching on Facebook on the live stream, or you're watching on YouTube at Super FM Lagos, you could drop your comments there as well. We would read them real time and give you the feedback that you need. We'll be going on a quick break right now. When we come back from that break, of course, the good PAM Secretary, the Dr. Emmanuella Zamba, is still in the building, and we would be asking some other pertinent questions. Stay tuned. We'll be right back. Yes, Ilera Kulawanli, it means the well-being of Lagos is what we are chasing. This is Lagos, of course, this is Super FM 92.7, your one family, one radio station, reaching you live from Lagos City, Nigeria, and we are having quite the conversation on Ilera Eko, on family matters. The healthcare system in Nigeria, the healthcare system in Lagos precisely, is taking a rather interesting turn, and the Lagos State government is putting itself in front of this to make sure that as much as possible, people live their best lives and have access to affordable healthcare. Now, at the start of this conversation, the guest here in the studio, who happens to be the permanent secretary of the Lagos State Health Management Agency, Dr Emmanuella Zamba, who has been here before, came again to have this conversation with you because it's important that we lead with information. Now, it is statutory in Lagos State that you have health insurance. As much as possible, aside the fact that it is statutory, it is a no-brainer that if you can get something for cheaper and it is the same good quality, but you're getting it cheaper because you paid in advance for it, and it's not even a huge payment, because we'll be talking about the eventual plan of what the payment plans are like and what you can do. So the standard JARA plan and other conversations like that on Ilera Eko, in fact, they gave it a name that is very, very common. It's Jara. If you go to the market and you buy something, you say, madam, you know, go give me Jara. In fact, that's a language that every Lagosian or Nigerian understands. If you're speaking to an Igbo, Hausa, or Yoruba person, you say, madam, you know, go put Jara for that rice where you sell for me. They will put maybe one hand or two, and I don't put Jara. And this is what the Lagos State government is offering us with the Ilera Eko plan. But then it's a conversation that we are having with the permanent secretary of the Lagos State Health Management Agency. She's answered a lot of questions, and like I said, you can watch us live on Instagram, on Facebook, I beg your pardon, and on YouTube. And if you want to watch this episode again, it's still on the website, it's on the page on Facebook and on YouTube. So you could watch reruns. Maybe if you have questions that you probably didn't quite get answers to, or you missed the first part of this conversation, you could go watch from the scratch and get all of those updates today. But this is a show that would continue for a long time, because of course, the Lagos State Health Management Agency will be back again next week. I said if you want to be a part of the conversation, you've got questions about the Ilera Eko plan, you want to know about how it is accessible in your neighborhood, the places you stay. Maybe you live in Badagry, you live in Ojo, you live in Ebute Meta, wherever you are in Lagos, Ikorodu, Ekpe, there are plans and there are ongoing conversations in all of these areas and local governments, and they have regional offices that you could visit to be a part of the conversation. It's almost seeming like I work with the Lagos State Health Management Agency right now, but then it's just because information is valuable and I've been able to gather enough. So if you would like to ask questions, call the number 0805 092 0927. Now, for clarity, for clarity purposes, if I choose to register on Ilera Eko and I register on a private health insurance plan, is there any implication on this particular thing for me as an individual?
So, from the question, he already has a private health insurance.
Yeah.
So he needs to have a conversation with his HMO as to how he would now be in compliance with the Lagos State executive order by Mr. Governor, as to how you will now have be covered by the social health insurance plan. So it's a conversation that the agency and government has been having with the HMOs. They would need to raise that question with their HMO. Okay, so
we just lost that call, but then you could call us back 0805 092 0927 to ask your questions. You could call there, or you could send a WhatsApp message to 0705 6900 927. Of course, there are lots of questions around this. I'm sure you're thinking, how do I get into the Ilera Eko plan? What do I need to do? What are the rates like? This is a conversation that is still open to you. We're still here to 10:30, so make yourself available right now to ask these questions. Now, this is another question, a follow-up question that I have. What are the benefits to be enjoyed if a resident enrolls on the health insurance plan, and how much is it right now? What are the plans like?
Okay, so I'll start with the cost. For an individual, it is 15,000 per year.
15,000
per year.
That's 15000. Wow. Wow.
For a family of 4, which is husband, wife, and 2 children
kids,
under the age of 23, that is 55,000.
So please hold that thought, man. Let's get to the calls real quick.
Okay.
I apologize for continue there. Hello, good morning. Hello. Hello. Okay, you'll do well to call us back on the lines 0802 502 7711. You can also call 0805 092 0927, or alternatively, you could call 0705 0890-4927. Call any of these lines and let us have a conversation. You could hear from the horse's mouth today. Hello, good morning.
Hello, good morning, sir.
Yes, good morning. What's your name and where are you calling from?
Oh, my name is Prince. I'm calling from Lagos.
Praise from Lagos.
Yeah.
Okay, Praise.
I
Go ahead.
don't have much questions. My question is that I want to ask the doctor. Hello, can you hear me?
Yes, we
Yes,
can hear
we
you
can hear
loud
you.
and clear.
Yes, I want to ask, what are the benefits for enrolling in the Ilera scheme compared to private HMO?
Of enrolling with Ilera Eco as opposed to enrolling with the private healthcare agency. Okay, so please listen in and you get the answers because we want to take another call right now.
All right.
Okay.
So that's a bit of a catch-22 question because we're not in the business of demarketing the private HMOs.
Okay.
Everybody has their markets which they are playing in. Let me put it that way.
Okay.
So for us on the social health insurance plan, so I'll just concentrate on ours. It is affordable because it is heavily subsidized by government.
Okay.
And you can access the care from both public or private facilities
Okay.
as long as they are on our network. And the benefits range from just having your general outpatient department, I have a fever, I have a cough, I have a headache, and things like that, up to having been admitted for up to 15 days in a year.
Wow.
Antenatal care, delivery is free. Cesarean section is free. Once you buy the family plan, you can get that free. We also conduct surgeries, so things like appendectomy, herniorrhaphy, those are free. We've added eye surgery, so you can have a cataract surgery done on the scheme. You can have your pterygium removed on the scheme. We do incision and drainage and all those minor surgeries, that is on the scheme.
Yeah.
You can also, of course, have your lab tests done, blood tests, blood chemistry and things like that. X-rays are also done. Ultrasound scan is also available where it's indicated. We're very big on chronic diseases, so hypertension, diabetes, you'll be able to get your prescription fill-outs. We do asthma. We also treat sickle cell. We have some things on the plan that is beneficial to sickle
directed
cell.
towards sickle cell.
Sickle cell, yes, indeed. And even people that suffer from systemic lupus erythematosus, we do have some of those things on the plan. Of course, you will get your drugs from us. You can either get that from within the hospital or you go to the nearby community pharmacy, which we have partnered with, and you'll get that list.
So there's also the partnership with pharmacies to see that when drugs are prescribed and probably if they're really very expensive, subsidies on the drugs.
You can walk into the community pharmacy and get it for free. You also have access to telemedicine.
Wow.
You also have access to walking into a virtual booth. We have those virtual booths currently in about 5 of our markets, and we are aiming to spread that into about 300 locations so that we do not clog up the hospitals all the time. If you have like something, maybe just a minor issue, you just call the doctor, which is a 24-hour service that is available to you under the scheme, and you get yourself sorted. If you've been with us for more than 1 year, you can have cancer care covered under the scheme up to a certain limit. You can also have dialysis sessions done for those people that suffer from chronic renal failure. Should I go on? You can see that
it's quite a lot. And the truth is, I'm just trying to, I was even like, following what's going on Facebook. If you're watching on Facebook, you want to drop your comments there, please do by all means drop your comments on Facebook, on YouTube as well. Now, there are a plethora of things that you can benefit from here.
Indeed.
And the last caller, Praise, who called, said he wanted to know what the benefits were as opposed to the private organizations and everything. And I like the way you led by saying we are not to demarket any particular brands or institutions. There is the partnership that comes with them, and then there is also the fact that the Lagos State government is just giving so much more to the people. And then we were talking about the price before we even went on the call.
Yes.
We were talking about the price, and we talked about 15,000 naira for the individual from 23 years and above. 15,000 naira for a year. We said 55,000 naira for a family of 4,
and 80,000 for a family of 6.
Family of 6. Wow, that's really very amazing. Okay, I think a message just came in here. Okay, so this one. Let me see what this message here is saying. Says questions for Ilera Eco. Considering that there are market women that earn daily, how affordable are the premium for someone who may have a fixed income? And then are there payment plans tailored to suit their income patterns, that whether for people who are salary earners or even market women who probably sell and make money on a day-to-day basis? They probably don't even have bank accounts, of course, and savings plans that they can go with. Then it says, if a market woman or her child needs emergency medical care, how does the Ilera Co. ensure they receive swift and adequate treatment. Follow-ups, are they provide provisions to handle cases where someone has just not yet completed their premium payment? So of course, like so many questions in that one.
We are very big about advancing coverage within the informal sector.
Okay.
Who are those that have largely daily income.
Okay.
As opposed to those of us within the corporate or formal sector.
Yeah.
And so recently we launched an initiative called the Ilera Cooperative.
Ilera.
And what that cooperative helps you to do is that when you sign up for that cooperative, the cooperative makes sure that your payments are made to the agency, and you can now reimburse, sort of. It's kind of.
So it's a loan kind of conversation.
Sort of that sort of thing. They guarantee that you get your health care because they're paying the agency on your behalf, as long as you make your own monthly payments to the cooperative. So you're guaranteed that you will get the same service as someone that paid upfront, whether you're paying monthly or not.
Or instrumentally.
You have to join that cooperative to be able to have access to that. There are other benefits to joining in terms of things like having food produce that would be much cheaper. You have access to that. We've partnered with some people to do that.
So it's for because I'm interested in that food conversation. I'm very interested in the food conversation.
We partnered with some people within the agro sector so that you can actually get food at a reduced rate than what you would get normally in the market. So those are some of the advantages. And we're looking at other wellness things that we can add on. There are quite a few things. When you join on, they will explain to you what would be your benefit and what you can get access to, including also loan from the cooperative that we partnered with on this regard.
So these cooperatives, is it something that is readily available? For instance, is it a website thing, or they have sensitization going on in markets, and since it's targeted at that audience?
We launched it early December.
Okay.
And we're rolling out. I think they started yesterday actually. They were one on the radio station.
Ilera.
Roll out Ilera.
Okay.
Once you join. You can do a phone call. On the numbers I gave, the toll-free lines, they will give you information as to how to join. You can go onto our website, and you would also get access. You fill a form, you make a payment, like a membership sort of payment. I think it's 1,000 naira. You make that membership payment, you fill out the form, and immediately they will ensure all your details get to the agency, and then you are now activated in the following active month, and you continue to enjoy.
So the instrumental payments, how is it broken down? So you said you register with 1,000 naira. You're supposed
that is just the registration.
The registration. So when what are you paying instrumentally?
You pay 6,000 for the gold plan. I think you pay. We have bronze, silver, and gold.
Okay.
You pay 13,000 if you are a family of 6.
Okay.
You pay 10,005 if you are a family. So it's like a quarterly. I think that's the quarterly payment.
Quarterly payments.
10,000.
So every 4 months.
Every 3 months.
Every 3 months. I beg your pardon.
Yes. You can now make that into smaller
chunks through the cooperative.
Yes.
Wow.
Yes, and then for an individual, it is 6,005.
Wow.
Yeah. So you just make those payments, and they add up. Because there are administrative issues to ensuring that we have backup with the facilities. We do send your funds to the facilities every month, whether you go there or not.
Wow.
So that's an advantage for you to come in. What was his other question? He said something about emergency care. Emergency cases, yeah. Emergency care is accessible under Ilera. Even if you are not near the hospital of choice, if you walk into that facility, as long as you are registered and you are enrolled under Ilera, you can get emergency care, and that provider would be reimbursed once they are a provider on our network.
And once the person has been able to establish that, I am actually under the Ilera plan.
Exactly. We are now even taking that a step further to work with other providers that are yet to come onto the network. So if you walk in there and you are one of our enrollees, we will reimburse that provider for looking after you first aid, and then have you referred to our own facility. So that will be rolling out hopefully before the end of the quarter. So emergency care is covered.
It's taken care of.
You even have facilities to do an annual wellness screening under Ilera. You just go in and just to make sure that everything is functioning well.
Wow, this is amazing. It's affordable. It is thoughtful, because everything that that was just a random question that a caller asked, and then we got follow-up questions that people were asking about emergency care, which means every angle to healthcare in Lagos is being covered. So why aren't you on the plan is the question that I'm asking that person listening right now. Why aren't you taking advantage of this? If the PAM secretary could come out today to have this conversation with you to tell you about the importance of Ilera and how to enroll. Of course, there's a website which is
www.lashma.com.
www.lashma.com, which is the Lagos State Health Management Agency.com. So, of course, you could visit right there and enroll. There are phone numbers that you could call.
There are toll-free call centers. They're 24 hours. There's 0700 Ilera, which is our sales hotline. There's 0800 Ask LASHMA. And there's 0800 Ilera. Those lines are for inquiries. But the 0700 Ilera is the sales hotline. We have WhatsApp numbers that you can type and they would respond to you. 070 453 58275. Again, 070 453 58275. And there's a second one, 070 461 60051. 070 461 60051. As I said, you can also send an email to ileraiko@lashma.com. We are very busy on social media. You can get us on Instagram, Facebook, Twitter, Thread, TikTok, LinkedIn, YouTube. We're also there as well. Lagos State Health Scheme. You'll be able to access us.
Thank you so much, Ma, for making out time to be here today. It's been my pleasure having this conversation with you. I'm enlightened, and I'm sure a score of our listeners, everybody listening right now who has stumbled on this conversation today is listening. Ilera on Family Matters is a staple. It's come here to stay on Super FM 92.7. So we'll be back again next week, Tuesday.
Definitely.
Follow-up questions and anything else, you could still drop your comments here. It will be the very first line of questioning from next week, Tuesday's episode. But thank you so much, Ma, for making out time today. It has been our pleasure. Okay, so that's the size of the conversation. Time flies when you're having a life-saving conversation, and that's what we just did on Ilera on the Family Matters. Stay tuned to Super FM 92.7. We'll be right back.